So the focus of this story is about what are there's actually a name for them. They're called long haulers, and they have Facebook support groups with each other. Entire online communities of people who find themselves now recovered from COVID, but with a myriad of health problems. And these are people who had no comorbidities, who did have some health problems prior, people different races, different ages, different sexes. It runs the gamut. So talk to me about what you in the medical community are learning about these so-called long haulers with these long-term problems.
Sure. So I think we need to learn a lot more about the long-term consequences of COVID, but what we begin to see through some of these groups is that about 20 to maybe as many as 50% of people will have some kind of persistent problems after hospitalization with COVID. Most of the long haul problems, I believe, are in patients who were hospitalized. So people who had no symptoms at all, and we know that that does occur, and people who had very mild symptoms generally tend not to have the kind of long-term problems that the long haulers have described. That said, there are some people who had mild symptoms, were never hospitalized, who seem to have some evidence of heart injury, for example, even a few months after the virus. And some people have some other, what we could generally call neurological complaints, fatigue, headaches, muscle aches and pains, and things of that sort. This is a very new virus. Obviously, we've only known about this virus and this disease for about 9 months now. And so there's still a lot to learn about what the potential long-term problems might be.
So let's talk about some of these problems. We're learning that it does damage to what, the heart muscle? Is that one of the heart problems?
That's right. So we do know that when people are hospitalized with COVID and they're ill and sick in the hospital, that about 20 to 30% of people can have evidence of acute heart injury. One of the major things that we can see is called myocarditis, or inflammation of the heart muscle. And we've seen this after other kinds of viruses as well in the past. So the idea that a virus can cause damage to the heart is not new. And we are seeing it with COVID, and we're probably seeing it more commonly than we would after flu or other viruses. There seems to be a particular predisposition to heart inflammation with the coronavirus. So 20 to 30% of patients, when they're acutely ill in the hospital, can have evidence of some heart inflammation and potentially heart failure. What's become clear as some of these people have been followed now for a longer period of time is that even after people recover and they return home, and again, even some people who were never hospitalized at all, as many as 15% or so may have evidence of inflammation. And another significant proportion of people, maybe another 30% or so, have evidence of injury to the heart that occurred at some point, prior, but is not necessarily ongoing. So the studies vary. Again, we're in the early days of understanding this, but it could be as many as 50%. Some studies suggest even 60 or 70% of people have some evidence of heart injury, though most of those people are not experiencing symptoms. So what we have to learn now is whether the evidence of heart injury on things like MRI scans and blood tests means that people are at increased cardiac risk or not, or is it just an incidental finding because our testing is so good for that kind of thing.
That is kind of scary when you think about it, because if you aren't having the symptoms and you did have COVID and you do maybe now have some sort of underlying heart issue, what do you do?
Well, that's a really good question, and we don't know the answer to that yet. What the stage that we're at now is really trying to understand how common the problems are, and what the relationship is between COVID-induced heart injury and long-term risk of heart failure for one thing, or risk of a more serious cardiac event, particularly say when people are exercising. Does it increase the risk of an arrhythmia, for example? We just don't know the answer to that yet, which is why we need more research on this. In past viruses that caused myocarditis and heart problems, the usual course is that people get sick and then they recover. And it's what we call a monophasic illness. It has a single phase of illness and then they recover. Whether there are some people, though, who will have prolonged symptoms is really the main concern, or prolonged risk of problems later.
And some people, younger, healthy people, are reporting that they just don't have the same energy. They can't work out in the gym like they used to, or make it through that yoga class, or those kind of things, more lung capacity issues, I guess, is how you'd refer to it.
Yeah, that's right, Patty. So I think the way I think of it is there are a couple of different ways that this can happen, right? You can imagine that when somebody gets acutely ill, maybe they're hospitalized and they have really severe lung problems, or maybe they're able to stay home, but they still have breathing difficulties. What's happening is that the lungs are being damaged during that time. And then they may recover from the fever and the acute feeling of illness, and the breathing problems may improve. People who are hospitalized come off the ventilator, they're able to return home, but some lung damage may have occurred during that acute phase of the illness. Then they return home, they go about their activities, and they find that they just don't have the same exercise capacity because of the damage that initially happened. And some of the tissues in the body are not able to reproduce themselves easily. So if you damage part of your lung, if you take out a piece of your lung, it doesn't grow back. The liver does, but your lung doesn't grow back in the same way. And so those people may just have prolonged symptoms due to the initial damage that occurred. The other possibility, and the one that we're just beginning to be able to explore because people have been followed long enough, is whether the virus leads to persistent damage, that cumulatively continues over time, or whether there may even be the possibility of kind of cycles where people recover and then they suffer damage again later because the virus comes back, maybe from an outside infection or potentially somehow reactivated. We haven't seen a lot of that reactivation evidence yet, which is good, of course, but that happens with other viruses, and so that's something to be aware of. So that's how I see this. A lot of people who are acutely ill from a multitude of sources, and people have severe viral or bacterial pneumonias and are in the hospital before we ever knew about the COVID pandemic. Those patients would also often feel debilitated, fatigued, just unwell. We call it malaise, lack of exercise capacity. That occurs after serious critical illness of all kinds. And so this may be another manifestation of that problem.
And do those people ultimately recover, or do they have lifelong problems?
Some do recover, some don't recover. It depends how serious the initial injury is, and it often depends on what their underlying health status is. We know, for example, that people who have underlying cardiovascular disease, like high blood pressure, obesity, diabetes, people with prior heart disease or strokes, seem to have a worse outcome, at least in the short term, with COVID. And we don't know this yet. We're studying it, but the concern would be that they would have a worse long-term outcome as well. So, the health you have going into a bout of COVID probably determines how well you'll do long-term as well.
Now, you are the president of the American Heart Association, but you are a neurologist by training, and so the brain aspect of this, the neurological aspect of this, what's the concern there?
I'm glad you asked that question, Patty. Yes, there is concern that people could have long-term consequences from this. We do see evidence that this virus can cause blood clotting problems, and it can even cause strokes in people. About 1 to 3% of people who are hospitalized with COVID can have a stroke. So that is of concern, of course, in the short term. And some of those people who have a stroke may, as a result of the stroke, have long-term consequences, similar to what we were just talking about with the lung and the heart. We do see people who recover and then long-term, many weeks later, have headaches. Sometimes they're very difficult to treat. They can have muscle aches and pains, and the same kind of malaise and fatigue. And again, those are the kind of symptoms that we often see after other kinds of viruses, like the flu, which some people are probably very familiar with, giving that feeling of muscle aches and pains and exhaustion and headaches as well. So it can be that same constellation of symptoms. And we see them after the coronavirus as well. There is some concern. We've seen this with the other coronaviruses that caused the SARS pandemic in China, for example. It also affected Canada, and the Middle East respiratory syndrome that occurred several years ago. Those were also coronaviruses, and some of those could actually infect brain tissue. And also in animal studies, they're able to infect brain tissue with similar coronaviruses. So there is concern that this virus similarly may be able to infect brain tissue. At this point in time, there are very, very few, less than a handful of cases where the virus has been found in the brain and surrounding tissues. So we don't have good evidence of that yet. But that's a concern because, again, we've seen this with other very similar viruses, and sometimes viruses do get taken up into the brain and reactivated with other viruses, and we don't want to see that happen here. We just don't know if it's happening yet.
So when people talk about brain fog and mental confusion and lack of concentration, I guess that's maybe a fear for them. Do they have some kind of neurological issue if they don't think they think as clearly as they previously did?
That's absolutely right. And it's a reasonable concern. Again, so far we haven't seen evidence of the brain being directly invaded by this virus. If it does happen, it's extremely rare. But what does happen with this virus is a systemic inflammatory response. So as the body fights off the virus in the lungs and the blood vessels throughout the body, immune activation occurs, molecules that activate the inflammatory system. And those molecules actually make you feel really lousy. That's we call it the systemic inflammatory response syndrome, when the body is flooded with these chemicals that are fighting off the infection. And as a secondary effect, they can contribute to this brain fog. They contribute to that fatigue and malaise. It's why you feel terrible when you're sick. So it's the secondary inflammation or the indirect effects of the inflammation that make us feel so lousy. And I think that contributes to a lot of what people are experiencing.
My last question is, there's an expression, dead men tell no lies. Is there data, are the various countries talking to one another through autopsies of coronavirus patients when you get to actually look at the heart, look at the brain, look at organs? Are they speaking the tales of the dead man?
Well, I like the way you put that. Yes, absolutely. Autopsy studies, what we would also call biopsies or tissue studies, pathological studies, are a very important part of understanding what happens with this virus as well as any other disease. I can tell you that at Columbia University Medical Center, for example, we have autopsy studies going on looking at brain tissue to see whether the virus is found in the brain. And that's why I tell you that so far we have not seen a lot of evidence of direct brain invasion. Similarly, with regard to the heart, where people have looked at it in the pathological specimens, some from autopsies, some from people who are still alive who had a biopsy done. They had tissue from the heart removed. It's extremely rare to find evidence of the virus in the heart tissue itself. So most of those brain heart effects seem to be secondary inflammatory effects from the infection rather than the virus itself damaging those tissues. But again, it's still early days. We're still learning more about it. And in some cases, it has been found.
So to those who make light of this virus, who say, oh, it's a flu, you'll get over it, you'll be fine, it's only old people in nursing homes who die, what do you say to those people?
It's absolutely incorrect to think that this virus does not affect young people, healthy people. We are all at risk from this virus. It's true that certain cardiovascular conditions, as well as age, increase the risk of complications, but young, healthy people have gotten very ill, have had strokes. I've seen them. Some have died from this virus. Thankfully, that's rare, but it does happen. We are all at risk, and we all need to be very careful, wear masks, socially distance, take it very seriously. We are not out of the woods. Recent evidence, recent days have shown us increasing numbers in half of the states in the country. And this is not going away anytime soon, much as we would like it to, and we'd like to deny anything is happening. That's just not the case. And the complications from this virus are still going on, unfortunately.
Dr. Elkind, thank you for your time.
Thank you, Patty. It was great to talk to you.
Likewise.